Hello. What color is this? What about this? What color is this? What color is this? What color is this? What color is this? Good. Can you feel this? Can you feel this? How about that? What about this? What about this? Can you feel that? And this? Good. Can you feel this? Okay, stick out your tongue. Perfect. And can you tell me how many dots you see? What about now? What about now? Very good. And can you smell this? Okay, can you smell this? Okay, now can you follow the green lemon and ignore the yellow? Good, now switch over to the yellow. Okay, which one's closer to you? Which one's closer to you? Which one's further away? And which one's closer to you again? Okay, very good. Can you do me a favor and can you taste this? Take a bite. Okay, very good. And can you smell this? What does this smell like? What does that smell like to you? Okay, and what about this? Wonderful. Can you see the smelling chart? Good. What letter is this? Okay, what about this? What letter is this? What letter is this? What letter is this? What letter is this? Okay, can you read this line for me really fast? And this line really fast? What color is this? And what color is this? Okay, very good. I'm going to show you a couple of different colored lenses and just tell me what color you see, okay? Good. 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 Very good. Okay, tell me which fingers are moving. Tell me when you see them in your vision. Good. Tell me when you don't see them anymore. And tell me when you see them again. And not anymore. Perfect. I'll be giving you a quick nose piercing just to make sure that your nose is clean. So I'm just having a feel of your nose. Perfect. Your nose is perfectly good. So what we're going to do is we're going to actually make sure we alcohol swab it first because we want to double check, okay? We can't just joke around about stuff like this. Okay, making sure that's clean. Good. Let me just make sure that my tool is clean. Okay, close your eyes. Okay, very good. And just make sure I put that piercing in. Okay, making sure it looks good. Okay, and taking it back out. And now for the final piercing, okay? Just lift up your head a little bit. Okay, turn this way. Turn this way. Okay, and putting the piercing back in. All right, I hope you love that. We're gonna do a quick ear exam. Can you hear this? Can you hear this? Okay, what about this? What about this? What about this? Okay, I'll take a really quick look into your ear. Just relax while I take a look. Just make sure everything is okay. There's a little bit of earwax, but you're gonna be okay. Okay, everything's looking really good so far. Okay, perfect. We're gonna do a really quick tuning fork test. Tell me which sound is louder, 1 or 2, okay? 1 or 2, okay? 2 or 1, 1 or 2, 2 or 1, okay? And repeat this back to me. Lemonade, good. Watermelon, good. We're gonna quickly do a smell test. Does that smell like? Good. What about this? What did that smell like? Good. And what about that? Okay. And smell that. Smells so good. And what about this? Okay, perfect. And what about this? Good. What about this? Good. What about this? Okay. And what about this? Perfect. And what does this smell like? Okay. And what about this? Perfect. And now my homemade concoction. What does that smell like? Okay. What about this? Good. And what about this? Perfect. Dentist appointment. Open your mouth and say, "Ah." I'm just going to count your teeth. 1, 2, 3. Okay, have you had your teeth cleaned? Have you ever had a root canal? Stick out your tongue. Say, "Ah." Okay. Looks like you need a cleaning. Yeah. And I'm just going to check to see if you need any cavities filled. So let me just check the tooth up here. Okay. What about down here? What about over here? What about over here? Let me just check over here. Just keep your mouth open. Okay, we're almost done. Just checking the enamel. Looks like you need a cleaning. Yeah, so let's just start brushing your teeth. We're still brushing. Yes. Brush. Okay, and take a sip of water. Swish and spit it out. Perfect. Your breath should smell a lot better now. And let's just get your tongue. Okay, looks like we're all done. Welcome to your hair appointment. Is it okay if I brush your hair really quick? Okay, so I'm just going to brush your hair. Okay, looks like that brush isn't working, so let me try this one. Okay, it looks like it's still a little bit tangled. I'm just going to use my comb. Okay, now I'm going to blow dry your hair. I'm going to blow dry your hair. Okay, and then a curling session. Perfect. Straightening first? No problem. Or using the straightener to curl. Okay, yeah, that sounds like a good idea. What do you think of these curls so far? Do you like them? You want to try different curls? Let's try these. These are a little bit more like, not as wavy. You like these better? Perfect. Well, looks like we're done. Okay, do you see the hearts? Good. Can you tell me if I am close to you or further away? How about now? How about now? Okay, tell me which color I'm tapping on. Okay, what about now? What about now? Okay, very good. All right, do you see these? Perfect. Tell me if I'm close to you or if they're further away. How about now? Okay, what color am I tapping on? What about now? What about now? What about now? What about now? Okay, do you see the paws? Good, okay. What color am I tapping on? What about now? What about now? And what about now? And how about now? What about now? How about now? What about now? Am I close to you or further away? What about now? What about now? What about now? Okay, we're going to do point closer or further away. So which point is closer? 1, 2, or 3? Okay, what about now? 1, 2, or 3? Which one's closer to you? 1, 2, or 3? Okay, how about now? 1, 2, or 3? What about now? 1, 2, or 3? What about now? 1, 2, 3. 1, 2, 3. Okay, and 1, 2, 3. And 1, 2, and 3. 1, 2, and 3. 1, 2, 3. What about now? 1, 2, 3, or 3, 2, 1. Perfect. I'm going to measure you with a couple of different tools. Let's just see how symmetrical your face is. Just sit very, very still for me, okay? Very, very still. I'm going to measure you. Just relax, okay? Quick measurement. Okay, we're going to switch it up a little bit. Okay. And we're done. Quick color vision test with markers. What color is this? Good. What color? Okay, what color is this? Very good. What color is this? And what about this? Okay, what color is this? Okay, and what color is this? 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 Okay, and what color is this? And what color is this? Good, what color is this? And what color is this? 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 Okay, what color is this? What color is this? What color is this? And what color is this? What color is this? What color is this? And what about this? Perfect. Sharp or dull? This is dull. This is sharp. Okay, tell me what you feel and close your eyes. Okay, let's get started. Good. What about now? Okay, what about now? 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 How about now? And now? And now? And now? And now? And now? Okay, now we're going to do dull or hard, okay? Dull, hard. Let's get started. What's that? What about this? What about this? What about this? And now? And what about now? What about now? What about now? And what about now? 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 We're just going to do a very quick face surgery with these, okay? So just relax. I'm just going to give you a quick face surgery. Just gonna laser everything off. It's going wonderful, no worries. Everything is going as we planned. Shouldn't have to worry. Everything is going wonderful. Just stay where you're at. Everything went beautifully. I'm gonna have you follow my instructions, okay? So I want you to look at the green lemon and ignore the pink. Good, now look at the pink lemon and ignore the green, look at the pink lemon and ignore the green. Ignore the green lemon, ignore the green. Okay, tell me which lemon is closer to you right now. Which lemon is closer to you right now? What about 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 now? Okay, look at my nose and ignore both lemons. Just ignore both of the lemons. Just ignore them. Just ignore them. Just ignore what I'm doing. Just ignore what I'm doing with the lemons. Okay? Alright, now look at the purple line behind me. Okay, now look at my nose. Okay, look at the pink lemon. Look at the green lemon. Look at the blue light behind me. Okay, perfect. Look at the pink lemon. All right, I'm gonna have you do what I say. Okay, go like this. Pop. Perfect. Go like this. Don't let me press down on your shoulders. Don't let me press down on your shoulders. Good. Follow my finger as fast as you possibly can. Follow my finger as fast as you possibly can. Spell run. Spell run. Keep following my finger. Okay, look over here. Good. Look over here. Good. Look over here. Look over here. Perfect. Close your eyes. 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 Tell me, what do you hear? What do you hear? Okay, what do you hear now? What do you hear now? Where do you hear it? Tell me, where do you hear it? Tell me, where do you hear it now? Good. Tell me how many dots you see. Good. And now. And now. And now. Very good. What about now? And what about now? 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 Okay, tell me if you see a flashing light come into your vision or a solid light. Okay, tell me when you see the solid light coming into your vision. Okay, and tell me again. Perfect. Stick out your tongue, say, ah. We're going to be checking your temperature. Okay, looks like your temperature is good, but let's check your BPM. Stick out your finger. Okay, very good. And check your temperature. 98.2, which isn't bad. Okay, we're gonna check your heart rate. So just give me 1 second here. Just stick out your arm. Okay, can you hold this for me? Okay, heart rate looks good, but I am going to listen to your lungs as well as your heart with my stethoscope. Okay, so just breathe in, hold, breathe out. Good, breathe in, hold, breathe out. Good, breathe in, hold, breathe out. Good, breathe in, breathe out, breathe in, breathe in, breathe out. Hey, so can you tell me a little bit about how much hair you'd like cut off? Okay, so what are we thinking? Maybe about, do you think 3 inches? That's 3 inches there, or maybe like 4. You think 4? Okay, that's brave. Are you sure? All right. I'm gonna make your hair wet. Okay, we're gonna go ahead and just. Okay, and a little bit of thinning, you think? Okay, I agree. You have a really thick, luscious hair. I always need my hair thinned as well because it's so thick. I'm gonna go back in with the other scissor now just for a little bit. All right, you look amazing. Hi, I'm gonna quickly cleanse your face, prep it for bed. Okay, so we're gonna go ahead and just remove all of that makeup. Okay, so okay, now that the makeup's removed, we're going to put on your night cream, which is going to be so nice for your skin. You're gonna love it. You're gonna absolutely love it. Okay, and now some really hydrating facial mist that will just make you feel so, so good. Okay, perfect. And just going to just dry your face. Just dry. Do you feel good? Awesome. Welcome to your face gouache and reflexology treatment. We're gonna go ahead and gouache your face. Okay, we're just gonna contour the jaw. Just gonna contour the jaw, contour. Okay, and then right here, okay? Okay, and then a little bit of reflexology, okay? So just relax. We're going to do that right by the eyebrows. Okay, should be super relaxing. Pressure point therapy. Just by the eyebrows. Should feel really good. Okay, and we're going to finish off with some ice globes, okay? So we're just going to go following the cheekbones. We're going to follow the cheekbones. It's amazing. Okay, I'm going to show you a series of cards, and I want you to tell me what you see. Lips, good. An orange fish, believe it or not. Yes. Yep. Yes. Yes. Mm-hmm. Do you see it now? I know it was upside down. Okay, and what is this? Good. What is this? What is this? What about this? And what about this? What about this? What about this? Uh-huh. Upside down again. What's this? Okay, and count really quickly. How many dots do you see? Good. How many dots do you see? Good. How many dots do you see? Okay. And what is this?